dual disorder. So a lot of kids with ADHD, autism, and also have reading issues. So that's usually kita guna grading lah. Macam contohnya, dia boleh in one line, zigzag, and then kena tengok height sebab stepping stone dan behavior is considered challenging when it is harmful for the people around them. This includes physical aggression as well as property destruction.
Hi, good morning, everyone. Welcome to our awareness talk on picky eaters, whether it's children, mostly children who are picky eaters, and we have here to welcome Dr. Norhana, who is a senior lecturer and dietitian from Faculty of Health Sciences in UKM. So today she's going to talk about picky eaters, to answer some questions about picky eater. Dr. Norhana, the floor is yours.
Hello, hi
Welcome.
everyone. Hi Sareen, how are you doing?
Good, thank you.
Good, Alhamdulillah. All right. First of all, I'd like to thank Serene, Chiling, and also everyone in the Mind Story for the invitation. All right. I hope that I could share a little bit from my experience, mainly from my clinics that I conducted together with our multidisciplinary team and the Child Development Center in Hospital Pakar Kanak-Kanak UKM. All right. Okay. Probably I could share my screen now. Okay. Yep, this one. Okay. So today we're gonna I think it's more of a discussion, a little bit about the background of picky eating, all right, among special needs children. Probably tell you a little bit of background, what I'm currently doing besides handling the multidisciplinary clinic for autism children. We also are running a research under with my PhD student under a local grant under the Ministry of Higher Education grant on picky eating among typical children, right? And then on top of that, previously my research are also looking into understanding the eating habits, the eating pattern among autism children. And there's also another study that we are currently doing is on cerebral palsy children. All right, but when we talk about picky eating in special needs children, it's usually with autism children, ADHD children that involves behavior issues that we usually recognize among this group of children. For CP children, as for now, the reports of being picky in terms of their eating habit, it's not that frequent compared to those two that I have mentioned before. The problem mainly looking into dysphagia, having sufficient intake. So those are the main issues when we talk about children with cerebral palsy. So with that, today we will probably focus more on autism spectrum disorder. And if you have any questions, I mean, the floor, if you have any questions relating to ADHD, can also be addressed. I'll try my best to address them. Yeah. Okay. So let's go. All right. So what will we cover today? Okay. The first thing is that we need to understand who are actually the picky eaters. All right. And then is it that important to discuss about the topic here among children with special needs mainly, all right? Because we know that picky eating issues are commonly discussed in among typical children nowadays. The discussion is it's getting more heated up, I think, yeah, because I think the awareness is has increased, right? Because there's a lot of other factors that we probably discuss later on. There are some similarities and differences between picky eaters among typical group and also special needs children. Okay, those are the things that we're gonna probably discuss today. And then, should we worry? Yeah, should we worry? Meaning that, is it important for us to address this issue? Okay, because we know that children with autism, for example, children with special needs, usually the main focus will be the therapy sessions, yeah, to improve their skills. All right, we know that parents usually their routine, their schedule are very busy. All right, to a point sometimes the importance of eating healthy unintentionally becomes the second priority. I mean, among the group, I do not blame anybody, because I know it's not easy to have a child with special needs, all right? But it's good for us to discuss today so that probably we could incorporate some of the interventions that can be done, all right? Okay, so next one would be, what are the factors affecting intake? I would say here affecting intake, not affecting the pickiness, but affecting the intake, right? Because it covers both picky and non-picky actually. All right. So and last but not least, I think it would be nice for me to share 3 case studies, all right, with the audience, with the hope that it can give an example to you in what are the how are we going to understand the nutritional issues for among our children, and what are the things that we can do in order to address the issues. Yeah. Okay. So who are actually the picky eaters? Okay. Okay. So this is actually, although it sounded like it's very common, to the word picky eating, picky eaters is actually very, very common now. But can we pin down who are the picky eaters? All right. Okay, because if, for example, if ASD children, they have a certain diagnosis test that they need to undergo, okay, which will be covered by the psychologist or the development pediatrician, then they will say that after several assessment, they will say confirm that yes, those children are being diagnosed with autism spectrum disorder. So they have a certain standard tool to identify them, right? But picky eaters, there's no standard definition. All right. So because we did allow me to share some of my findings, although it is not published yet because the studies are still being conducted. We did a focus group discussion among the healthcare practitioners. And the first question that we asked is actually, how do I identify picky eaters? All right. And we get a lot of answers. All right. And then because from the literature, it even says that picky eating are actually one of the feeding difficulty spectrum, although it is not under DSM-5. So therefore, there's no diagnosis for it unless they are RFID, ARFID. All right. And then also from Taylor 2015, saying that the definition of picky eaters is actually too broad and diverse, and the selection of this definition depends on the study conducted. For example, if that study is looking into number of food that the subjects taken, so it will be defined as frequency and also numbers of food that they take. So that is like, okay, for example, if he only take 2 to 3 types of food, so they can be considered as picky eaters. So and some also say that if we go to the third point, one of the definition of picky eaters is consumption of limited type of food. So numbers of food that they take. Number 2, not wanting to try new foods. Sometimes they call it as neophobia. All right, and the most common one that we get, all right, when we even talk to our friends, oh, anak I tak makan sayur dan buah. Macam tu kan. If they don't eat vegetables and fruit, they are terus kena chop. They are labeled as picky eaters. Okay, so those are the 3 most common definition. All right, that is by Van der Horst 2012. And then actually, our studies also agree with the 4th statement, saying that the picky eaters also refers to parents' statement about their child's food intake, such as not eating well or refuse to eat certain groups. Okay, this how do we relate this statement with our findings? Is that when we ask the healthcare practitioners, they say that sometimes they are being referred for the picky eating problem because the concern of the parents. Because parents says that, oh, I think my child are picky eaters. Can you please refer me to someone to address the issue? So it goes down to, because it goes down to the parents perception about the eating intake, the dietary intake or the eating habit of the children itself. However, okay, although there is a diversity in the definition of picky eaters, most researchers, okay, use element of lack of variety in food intake, fear of trying new foods, which is neophobia, and refuse to eat foods that are usually eaten, meaning that, for example, if the common food in the house is, for example, nasi campur or noodle soup. So, for example, they do not want to eat that. Okay, so that what it meant, and this all interferes with the daily routine of the child. So, if all this actually interferes with the daily routine, okay, it is considered as picky eating. Okay, for example, taking a long time to eat. Usually, we will ask, okay, how long do you take for your child to complete or to finish this one bowl of noodle soup, for example, kind. So sometimes they say that more than 30 minutes, sometimes an hour. All right. So those are the indication that the children are picky eaters. And on top of that, it's also giving problems to the parents, the children, and the relationship between them, to a point that they got really, really stressed, because uh, when it comes to mealtime, it was like a headache for them, for both parties, for the parents and also for the children. So as if like it's such what is it called? A very difficult time for the whole family, even to have a meal, a family apa ni? A dining time, all right? Meal time together. So those are the indications of picky eaters. All right. So probably I can move to the next one. Okay. So the second question, should we worry? All right. Should we worry? So before we look into this issue in our circle of group, meaning that the special needs children, uh, we probably good to take one step back and look at how is actually picky eating or the nutritional issues in the world among children nowadays. So when we look into the WHO reports, it says that 47 millions of children are actually underweight, okay, at the age of 5, and are moderately underweight, all right, and 14.3 millions are severely underweight. So that's actually a quite a big number, all right, for those who have malnutrition issues, all right. And in addition, 155 million children suffer from stunting. What is actually stunting? If we notice in our advertisement in our television, our national TVs, sometimes we do see those advertisement about a study anak Malaysia Sihat. Kan? If you see that there's a boy who actually it's a little bit smaller compared to their peers, right? And when he plays, he got tired easily, and then when they do the measurement, it is quite clear that that boy is actually much shorter compared to their peers. So stunting meaning that their height, the children's height, is actually below -2 SD when they do the plotting on the development graph, right? And why the stunting issues are worrying is because it affects it shows that the children is not eating sufficiently, did not have sufficient food intake, all right, that might cause other problems later on in their lives. Okay, and then we look into what is actually Malaysian says about the children's nutrition issues. All right, it says in our NHMS study, the National Health and Mobility Survey 2016, 13.7% of children in Malaysia are actually underweight. And then even worrying, 20.7% was stunted. all right? And 15.5 were actually wasting. Wasting meaning that a stage where it is probably we can say that it is before stunting, all right? So we can see that it's the highest group is actually those with stunting issue. Those are stunted. Okay, so and globally, the WHO has targeted 40% reduction in the number of children suffering from stunting, and the reduction rate is maintained below 5%. So meaning that the WHO is making this point, making this issue such a big priority in their action. All right. So next, what about picky eaters among special needs children? All right. We found out that picky eaters, they are actually more likely to be underweight, all right, and short in height than non-picky children. Why we do not have a prevalence to this? The main reason is because, as what I mentioned much earlier in my session this morning, there's no standard definition of picky eating. When we don't have standard definition, it is very difficult for us to, group this group of people, all right? And then there's a diversity among research. But whatever it is consistently reported that those picky eaters are more likely to be underweight and short in height compared to their non-picky peers. All right. So that's why it is very, very important for us to address the picky eaters issues. All right. And then when we look into their dietary intake, okay, mainly they are lack of protein intake, vegetables, and generally less calorie intake, which in turn has an impact on the child's growth. Meaning that when we do the dietary record interview, when this study did that, they can see that first, the calorie is definitely not sufficient. All right. Secondly, is that their protein compared to carbs, fat. Protein is one of the main micronutrients that are not being met in their diet. And secondly, is vegetables. Actually, vegetables and also fruits, fiber, I would say. All right. So sometimes why I think the second point is important is sometimes we need to identify what is the first step or what is the first nutrient that we are trying to we want the picky children to eat, to improve first, to explore first compared to other types of food, and it is quite consistent with the findings from my clinics. Yes, protein is always the case. Yeah, because picky eaters, all right, what I can see, they like usually the carbohydrate percentage or the requirement is quite okay, all right, because usually they like to eat it's like fried carbs like French fries, like keropok, all right, sometimes like chips, usually potatoes, all right, and not so much of rice crackers, but usually carbs based, and sometimes even they say that they like fried chicken. To our surprise, they don't actually eat the chicken. They just eat the batter and the crumbs. Right? So, meaning that the batter and the crumbs are actually carbs because they are flour and fat, right? So, sometimes we have to ask the parents whether the child finished the chicken or not, yeah, because that sometimes will give us some perspective about the potential deficiency in their children. Okay, Then okay, so now to the third point.
Dr. Hannah,
Yes.
I have a question,
Oh
before we
yes,
move on
yes.
to the factors. Now, because just now you mentioned the growth, the height, and the weight, and then of course the intake of protein. Now, maybe just to elaborate a bit about also the how all these, the height, the weight, and then the intake or less. The lack of intake of protein actually affect a child in terms of their performance in school, or in
Yes.
terms of their future, uh, basically their future. I think a lot of parents will definitely be very concerned about,
Yes.
besides the health, but on academic side, because
Yes.
that's the area that they go into.
Okay, I definitely agree with you, Serene. When we talk about academic performance, right? Academic performance is very, very relatable to healthy eating, good dietary habits. Yeah, because not just when we talk about picky eating, they have very limited food repertoire, meaning that they only take certain food. So when they only take certain food, they only receive or getting certain nutrients. All right. So when they only getting certain nutrients, meaning that there are a lot more important nutrients that are not being met. Okay, for example, when we talk about academic performance, sometimes even what is it called? Immu- it's not immunization. What is it called? Not easily susceptible to getting sick. All right. So all those is actually not just the macronutrient that we are aiming for, but also the micronutrients. All right. So meaning that those who are those picky eaters, they might not also achieve all the micronutrients that are important as the what is it called, the what is it called, as a nutrient in the metabolism, or as a precursor in the enzyme, for example, in order for them to be able to improve academically, or even as a general health. Yeah. So sometimes people don't see that because there is no signs or symptoms of um, insufficient micronutrients intake, because we do not, sometimes when we say that, okay, you need to take more iron, for example, or more zinc, all right, we could skip high zinc food or high iron food in probably in a day meal. All right, it's okay. However, if we consistently not taking food that is high in iron, for example, red meat, sometimes seafood, for example, like cockles, liver, we don't eat that on a daily basis, but we do need to incorporate that in our diet. So s- uh, besides academic performance, the health of the child are also a concern here, because we know that children with special needs, they are sometimes more susceptible to getting infections, and sometimes they got sick easier, because their antibody is not that strong, okay, especially those who have multiple congenital diagnosis, all right, that might increase their metabolism, all right, so they actually need more nutrient compared to their peers. So yes, those are the concerns, all right. Sometimes we don't see it now, but what we are trying to do here is that hopefully you don't see it later too. Okay, so that's why it is quite important for us to
Thank you.
address the
Thank
issue.
you. Yes, and yes, I mean, I support you're saying. So because at the end of the day, it's prevention. What we're
Yes.
doing is prevention, because
Yeah.
whatever disease that we, or even issues that we see in adulthood, is really all started from childhood.
Yes.
So I totally support what you're
Mm-hmm.
saying. Thank you very much.
Thank you. Okay. Okay. Probably I continue with this. Okay. Yeah, this slide about factors affecting intake. Okay. What interesting is that when we want to approach this cases relating to picky eating, it is not a one-way route. I mean that there's no standard um care for all cases. All right. We kind of actually when from my experience, when we see a lot of patients, mainly autism children with picky eating issues, it can cause by different factors. All right. Probably I can list down here from the experience, from my experience, and also from the literature that I read. First thing is the child's behavior. What does it mean with child's behavior? Meaning that um, sometimes they have behavioral issues, all right, that causes them not to be cooperative in the meal time, in a meal session, for example, meaning that, for example, they're not being cooperative during breakfast time, lunchtime, or dinner time, meaning that they do not want, they just doesn't want to eat because of the other behavior issues. All right. Secondly is child sensory issue. Child sensory issue is much related to the sensory attributes. When we talk about sensory attributes, it can be from the texture wise, all right, taste wise, all right, and also the look of the food even. All right, because we know that we eat with our eyes first. All right, we see the food. Oh, it looks delicious. All right, we might go one step ahead, and then sometimes you can see that the child will bring the food to their nose and try to smell it first. Okay, whether it smells good, it smells a little bit off. For them, they might not continue to take a bite. All right, then sometimes you can see that they will just press the food, want to see the texture a little bit, is it funny, those kind of thing. All right. And before they eat, and then what is it called, uh taste the food. All right. Okay, so sensory, mainly we will look into texture and taste. All right. I'd like to share here our recent findings, also, although it's a preliminary findings. When we compare picky eaters among typical children and special needs children, typical children are more picky towards taste. However, special needs children are more picky towards texture, especially when they have sensory issues like hypersensitivity, hyposensitivity. Yeah. I can give an example. A typical child who are picky that loves dairy food. So that child can have lots of food repertoire, in the sense where the child can drink milk. If there's no milk, the child will go with cheese. Or if there's no cheese, they go with probably carbonara spaghetti, those that have milky taste. When we say milky, sometimes if we say mouthfeel, they have this creamy mouthfeel. It gives the creamy mouthfeel to them when they eat that food. So typical children sometimes when they're picky, they have the main issue is that because they just love this one taste. All right. Compared to child with special needs, they are more texture sensitive. Okay, when they say this texture sensitive, if they like that certain texture, they will only go for that certain texture. Usually we see more crunchy texture. And a more severe cases, they are very picky, very sensitive to the texture and the taste. Okay, so that would be very, very difficult for, I mean, not to say difficult, but it takes sometimes take longer time lah, because we have to address one issue and before the other. So, and what I can say is pickiness or picky eating is more prevalent and sometimes more severe in children with special needs. So bring back to the slides before where we see WHO and even national study reported that the increase of stunting or malnutrition is getting higher, right, from time to time. Um, in reality, the number is actually much higher in the among children with special needs. Yeah. So although we do not have that data, that figure, because we know there's a lot of because there's a variety, it's not homogeneous, the data when we talk about special needs children. It's very heterogeneous. So that is one of the factors why we do not get that number. There's no big study on it. But we believe that when we understand that picky eating is much more severe in children with special needs, definitely the prevalence of malnutrition among them is also more severe. All right. So hopefully we could sit together, and this is why I think probably this session is being held so that we could sometimes with the hope that we could understand and try to address the issue the best that we can. Yeah. Okay. Okay, so the third point, the nutritional status of children is influenced by various factors. Okay, this is interesting, okay, because among them are the parents' nutritional status, the parents' educational background, and the mother's education during pregnancy. Okay, that's why I have to state that three references, because I'm very scared of this statement because it involves parents, all right? But when I relate that, I think we could not say no to this statement, although it might not imply to every family, all right? But when we did our focus group discussion, some of the responses are that because parents nowadays are very, very super busy. Yeah, because of the high living expenses, both parents need to work, on top of that, with child with special needs as part of their family members, having a child with special needs, also make them very so what do you call so their time are so equipped with all the things that they need to address. Yeah. So unfortunately, yes, it actually goes across the socio-demographic status, actually, not just B40. We also see those from M40 and a little bit of from the T20 groups, because it depends on how and who are the carriers, the main carrier of the child. All right. Okay, then it relates to the fourth point, no family meal time. Okay, because lack of time, sometimes you feed the child first, because I think that's quite common, because we know that this particular child is so picky with their food. Let me feed you first, all right, before we have our family meal. So the children are not being involved with the family meal time. So that is why sometimes picky eaters do not acknowledge, to the fifth point, do not acknowledge and appreciate food, because they don't see there's a meal time, family meal time at home. All right. And because of that, and then they are being fed even more. I mean, like they don't feed themselves. They don't see the food. They play and then they just open their mouth and then we feed them. Mama habis. Lepas tu they go run and then also the parent go run and chase them to feed them, right? So they don't appreciate the food. Okay. And last but not least, lack of energy and nutrients due to lack of food. I do have patients who are being. I think I will discuss one of this point in one of my case study. He was born premature, and then the weight is way below the standard weight. All right. So he is FTT, failure to thrive. Okay. Although he has improved some of the in terms of food repertoire, meaning that before this he only likes to eat certain food, but now he can accept more variety of food. But he just couldn't finish one plate of rice because he is so small, and then even to eat, even to if so- even to finish one piece of chicken, like a whole drumstick, is such an effort for them. Yeah. So sometimes we also need to see the medical history of the child. If for example, just now those patient with failure to thrive issues before, and they are still in the catch-up growth status, we need to approach them differently, right? So that they don't, because the key point here is that we do not want them to feel that mealtime is a hard time. We want them to enjoy mealtime, appreciate food, all right? And then and with that, we could expand the food repertoire. Okay, so those are factors affecting intake when we talk about dietary intake among children. Okay, it goes together for typical and also special needs children. Yeah. Okay. All right. I think we could go to case study number 1. Okay, adik L, 8 years old, diagnosed with ASD. All right, with body weight for age. Body weight for age is actually the graph body weight for age. Okay, it's actually normal. Okay, when we look into the dietary intake, he only take fish cracker, keropok, from a certain brand only. Yes, that's happened. And fortunately, he drinks milk. Okay. Okay. Other presentation when we see him is that there's a worsening in dental hygiene habit. Okay, due to sensitive gum. His mom reported that although she only uses wet cloth to help him brush his teeth, that also causes the gum to bleed. So very, very sensitive gum. So what is the problem here, right? Because when we see the patient, all right, if we don't look into the dietary intake input and also the other presentation, this boy seems very, very normal. Okay, because his height is okay, his weight is okay, he is even in the 50th percentile when we look into onto the growth chart. However, because of the choices of food that he took, which is only keropok and milk, all right. So we can see that definitely he is susceptible to having deficiency, nutrient deficiency. Okay, so how does this number 3 point relates to the number 4 points? It's actually worsening in dental hygiene habit due to sensitive gum. What I worry is actually the gum is represented as easily bleed. So it brings me to when first we saw the case, we got this point midway of the discussion. All right, when we try to address the food intake, dietary intake, and then the mom said that he doesn't want, only he wants the keropok, and then when at one point the patient opened his mouth, all right, and we can see that the teeth is not taken care of nicely. Then we ask the parent. A parent complains that it's so difficult for me to even brush the teeth because it bleeds easily. So meaning that if it bleeds easily, he must be in pain, right? That's why he doesn't want to brush his teeth. Okay. So um uh at that point, there's only one thing that I could think of if we look into nutrition deficiency. It is actually scurvy. Scurvy meaning that it's actually a vitamin C deficiency. We rarely, I even see your face, Serene. You macam, what is scurvy, right? Because we don't hear that anymore. Yeah, because that actually scurvy happens those time when they how do I say when the peniaga, macam, sorry if I use Malay words, all the peniaga pergi belayar, right, 3 months away, 3 months from in their on their ships, and then their lack of fruits and vegetables, which definitely they don't intake they don't take they don't eat enough vitamin C. Usually they bring orange. Usually they bring orange. But towards the 3 months, the third month, uh, they will be the it would the sorry the food the orange would be um will have finished is finished, right? Then that's why after the 3 months they got back to the shore, and then they straight away get all these complaints of bleeding gum. So when I saw this case, I was like quite surprised, all right? And we did a discussion with the medical doctor saying that could it be possible that the child has scurvy, right? And turns out they are not surprised, meaning that yes, it is very, very possible. Okay, so what we need to do is actually to check the biochemical data to prove that yes, it is very insufficient in their blood, in his blood, all right. And then what happened was that the boy is given vitamin C supplements, okay, to improve the vitamin C status. And the logic is that because there's no vitamin C in keropok, and also there's no vitamin C in milk, right? And he has been eating keropok and only milk for 8 years of his life. All right. So that's why I'm saying earlier, sometimes we don't see the potential of micronutrition deficiency until it reaches that stage. We can see the signs of nutrition deficiency. So what we did, definitely first we correct the vitamin C first, because we could not wait for the dietary intervention. Okay, because we could not achieve the requirement. That was the first thing. The doctor gave them supplement, vitamin C supplement, and then for the fish cracker and keropok, he is very, very strict. Actually, there's only one brand where the child's dad will order on a monthly basis from Shopee this particular keropok. Yes. Uh-huh. So what we did is actually we can say what we identify is that this patient have a very that has issues with his sensory and also issues with taste. So he got both sensory and taste. So what we did is that we try to keep the fish taste first, all right, and modify the food from cracker to other things that he can probably tolerate because of the taste of fish that he likes. So what we did is that it's not a straightforward process, but we discuss with the parent, what is your targeted group? So now your current food is fish cracker, all right? And what is your targeted fruit? Okay, definitely the targeted fruit is that the child can eat normal fish, not from keropok it's only, right? So so when we have the targeted food, so this is where we try the experiment where we change the texture first and then we keep the flavor on. Meaning that we could to a point sometimes we even suggest the parents to try make their own keropok. You know, sometimes change from keropok yang keras, the hard keropok, to the softer keropok, because we know that the fish cracker, the keropok, actually comes from the same batter, the same batch of keropok ikan batter lah, for example, and then they have one a cracker version, and another one is more a softer version. So we changed to that first. All right. When he is successful, then we change the taste of the fish. We reduce the taste of the fish, and then we try to incorporate other types of protein. Also, that is why sometimes parents' involvement is very, very important in the food innovation, I would say, part of this process. Yeah, I do get parents who bring the food that they prepared themselves for their child, which is very, very amazing and excellent, I think, because they take one step further in creating or new food, for their child. So those are the things that we did. All right, he's still in our clinic to see the improvement of his dietary intake. Okay. So
Dr.
yes,
Hannah,
uh-huh,
sorry,
it's okay.
I'm
Yeah.
just curious.
Mm-mm.
Just now you said the other doctors doctors gave him supplements like vitamin
Mm-mm.
C. But
Yep.
since he's like he's so picky,
Yep.
so how do you at least administer the vitamin C
Okay.
for him
It's
or to
actually,
him?
it depends on his severity. Okay. If sometimes in case of a very severe cases, we admit them to hospital. So we give them through IV. Yeah, I have one vitamin C deficiency. A second case, calcium deficiency. We do have that. So as the first step of intervention, we warded them. The hospital rewarded them to correct the level first. Then only we try to incorporate that with the food lah. Because as I said, it's not easy, to even to give like vitamin C supplement drink. Yeah, it's not easy for them to accept that. Yeah. So that was also one of the things that we could incorporate as what are the targeted food. Uh-huh.
Thank you.
When planning for the intervention. Yep. Okay, so we can move to the second case study. So Adik M, this is quite a baby, 2 years 1 whole month child with my LSD, BMI for age in a decreasing trend. Okay, and then although this boy, he's a full-term baby. Yeah, he's a full-term baby, not a preterm baby. He's a full-term baby. However, when he starts eating solid, we can see that the BMI for age is showing a decreasing trend in the growth chart. Okay, as for the dietary intake, only eat home cooked food and only eats at home when moms feed the child. Okay, and then other notes, nursery carer worries as Adik M did not want to eat food at the nursery and doesn't show interest to eat with other peers, because sometimes some children wants to eat because their peers are also eating with them, right? But not in this case. So what is actually the problem here? Okay, when we look at the dietary intake, the good point from eating only home cooked food is that he could eat any food that are being prepared at home. Okay, and then meaning that it's not as strict as the first case just now, only take 2 types of food. So there are certain food that are actually, when we talk about number of food, choices of food, there are more in this case compared to the previous case. However, what worries us is that the BMI is actually in a decreasing trend. So when it says BMI in a decreasing trend, it means that it's still insufficient. The dietary the intake is still insufficient for his growth. All right. And then what pushes this case is actually because even the carer at the nursery also gets so worried. Okay, and then to a point that the carer said that he is so afraid that the child will got sick under her care, you know, that level of worriness. So that is why the child are being addressed to referred to us. Okay, so how do we tackle this issue? First, we look at the positive points where the child can eat home cooked food. All right. So is it a sensory issue? Probably not a sensory issue, because it doesn't mention anywhere only takes crunchy food or only takes soft food. It doesn't mention here and mention in the case. To support that, the parent told us she feed whatever she eats. She feed the child with whatever food that she eats. Okay, and then the child will finish it. Only that probably just one not that much. That is why we can see that the BMI the growth is actually in a decreasing trend. Okay, so it falls to the second point where it might be a behavior issue. It might be a heavy issue. And then when we dig further, we got to know that the child uh, um, had only transferred to a new nursery. Right? So when he was transferred to a new nursery, so meaning that he needs more time to adapt to the new environment. Okay. So, but yet again, we could not wait, because it's quite alarming when we see the decreasing trend. So how do we go about it? Is actually we need to correct the behavior. We need to when we ask further, we got to know that um the child was being fed much earlier compared to the family, way earlier before the family dinner time, for example. All right. So that's why he did not appreciate mealtime. He could not acknowledge the food that he eats. He only eats because his mom feed him. All right. He only eats because his mom feed him, and probably because of the taste of her mom's cook, which is he is so used to. All right. So what we were suggesting in this case is that he needs to establish family meal time, dinner time. All right. So ask the child or sit the child together with the whole family and eat together. Let him take his own bite using his own spoon to scoop, and then because from there he will um uh, uh, um, uh, um, acknowledge the mealtime, and also they will experience how it's actually feeding, how it's actually eating process. It's not as easy as your mom's feeding you. So those are the things that sometimes will trigger interest among the child. Okay, the second thing what we did is that, because I would say the child's comfort food is his mom's cook food, right? What we suggested is that the mom cook his favorite food and bring to the nursery, not just for him but also for his peers. For example, meaning that okay, every Wednesday will be Adik M's apa ni, mom's cooking day, for example, cooking mom's Adik M's mom's food, for example, like that. Yeah, so that he can actually experience improve the behavior of accepting mealtime together with friends, with the comfort of having her mom's food, her mom's cooked food. So those are the things that we suggested, and hopefully it will help, because this is actually very new case, and those are the things that we suggested for this family. Okay, correct. So move to the last case, the third case study. Adik N, 7 years old. Current weight is 12.2. Is way below -2 SD. Weight at -2 SD is 18 kilograms, meaning that when we look the target, not to say the targeted weight, not, if I want to say it's a normal weight, it might also not be a normal weight, but at least the weight that touches the lowest graph, because we know that the growth chart has several lines. So 18 kilograms is actually the weight at the lowest line in the growth chart for his age. All right, so it's actually 18 kilo. So we can see there's a difference of 5.8 kilograms from what he should be weigh at his age currently. Okay, so the dietary intake, it's only bread and chocolate spread, one small bowl of porridge per day at the nanny's house. Okay, at home, he only eats carbonara, spaghetti, and roti canai. So other notes, height is consistently below -2 SD. So what is the problem here? It's actually definitely the growth. The growth. This is what we call stunted. All right. Not meeting the weight for height, not meeting the weight for age, and even not meeting the height for age. Okay. So what is the positive point in this case? Okay, the positive point is that there's a several food that he eats. He can eat bread, he can eat chocolate, he can eat porridge, rice, okay, he can eat spaghetti with carbonara sauce, and he enjoys roti canai. So that's a little bit relief for us, okay. Okay, but I mean, it gives me wonder as why to this patient is not meeting his weight or even height, right? Although he is quite number of food there, okay, not just only one or two food, until we ask the patient to bring, because usually in our clinic we ask the patient to bring their food and then show us how the child eats. All right, so that is where we see that for him to finish a quarter of bread and chocolate spread, because his mom brought chocolate sandwich on that day, and they cut into 4. He only and then she only placed 2, half of the bread. So meaning that kalau half of the bread, half of the sandwich chocolate, 1 piece of bread with chocolates in between. So he gently pick one bread and then slowly eat that bread. And it takes a while for him just to finish that that quarter of bread, So although he doesn't seems like refusing the food or struggling to eat, but it just takes longer, and then he just I don't think he even finished that quarter. Yes, he don't even finish that quarter during that session. And he seems happy. He doesn't seems like, oh, I do not eat enough food or something like that. He seems happy. So that goes back to the the point where I mentioned sometimes some children just don't have sufficient energy even to eat, because when we see, he is very small for his age. He looks like a 5-year-old boy, which he should be 7 years old, right? And then and then it is quite consistent. He only eats one, two, three, yeah, three meals in a day, with that amount of food, meaning that only one sandwich, one small bowl of porridge, and at home probably a plate of carbonara or half of a roti canai. So meaning that he did not eat sufficiently. He definitely did not meet the energy requirement for his age. So in this case, what we do, we acknowledge that he have some sort of pickiness. They have this criteria of picky eating, because apart from carbonara and roti canai, he will not eat anything else at home. All right. So we are very glad that he are able to he loves the nanny's porridge, rice porridge, because sometimes because we know that porridge sometimes we could enrich the porridge with other food. For example, you can put chicken, meats, and everything. So what we did was that first, definitely we will increase we did increase the energy from the food itself, meaning that um, although he eats the same food, but we modify the food so that he will have more energy or more calorie from the same food that he took. Okay. How do we do that? Is actually the easiest way to increase calorie is actually through fat. So when we say fat, why do we say fat? Because 1 gram of fat equals to 9 kilocal, compared to 1 gram of carbohydrate or protein only gives 4 kilocal. So almost double of the calorie from 1 gram of each micronutrients. So what we did, we for the carbonara, we asked the parent to increase through what is it called, cheese. We asked the parent to add cheese to the carbonara. All right. For roti canai, okay, we cannot do more of it. Probably we could ask for roti canai telur or roti canai sardine if he wants, right? Because it is bought outside. But whatever prepared at home, we encourage to increase fat from cheese for the carbonara. And then at the nanny's house, we ask to add oil before the nanny feeds the child. So although he took one small bowl of porridge, for example, the calorie might be 150, we could increase that to 200 per meal. Great. So when we increase the calorie from fat, with the hope that he could take more food in the future. What I mean with more food, meaning the portion will be bigger, because we want to train the gut to accept more food at one time, and at the same time he will have more energy from the food that he chooses to eat. Then after he have more appetite, right? Usually when they able to eat more, it's an indication that they have more appetite. So when they have more appetite, then we will introduce more food, more other types of food to the child. Okay. So that was our management for the last case that I'll be sharing with you today. Okay. So for the take home message, first, if we think that our child has a picky eating issues because because there's no a standard definition for it, because sometimes parents guts are quite true. Yeah. Okay, so first we need to identify the key issue of the nutrition problem, whether it's sensory issues relating to sensory or whether it's relating to behavior, and then establish meal time with the family. This is very, very important. Sometimes I do suggest, every weekend or an alternate weekend, bring your family um, to the shopping complex, because we know there's a lot of food there, and just try whatever food, make the food exploration as fun as possible, and then thirdly, increase food repertoire, aim for targeted food, meaning that when we want to plan, we need to have a clear targeted food. What is the food that I want my child to eat? So if the parent have a clear targeted food, so it is quite easy for us to help them in terms of what are the steps that they need to make to achieve the targeted food. Okay. Then chart the activities, success and failure, because we need to identify what causes the failure and what causes the success, right? When we see, especially for the next appointment. So from there, we could discuss better and set good eating example. All right, meaning that have an established meal time, and then appreciate food and eat a wholesome food, because those children are actually observing. Even special needs children, they do observe their environment, right? Yeah. So having a good example is actually one of the point to help them to eat better. And don't forget to praise each effort they made. Yeah, because we know it's actually a struggle, even that to change, to try new food. Even to sometimes they don't eat, just by bringing the food to their mouth and touches their lips is also a success. Okay. So with that, I think that's the end of my slide. Yeah. Thank you, and I really, really wish all the best to all parents. Okay, and I like to take this opportunity, yeah, sorry, to just wish happy Autism Awareness Month to everybody. Okay,
Yeah,
thank you.
I forgot about that. It's this month, isn't it? In
This
April.
month, and it's, yeah, April.
Yeah,
Usually
yeah. Same,
tomorrow,
same goes.
second, yeah, 2nd of April usually.
Oh, tomorrow. Okay.
Yeah. Uh-huh.
All right, great. Thank you so
It is a
much,
big
Dr.
thing.
Hannah.
Okay.
Um, I mean, I can't speak for everyone else, but I can speak for myself. Is thank you so much. I've learned
Okay.
quite a lot.
Okay,
However, I
thank
do
you.
have one
Yeah.
last question.
Sure.
Is because here, of course, for those who will be watching this or are watching this right now, it's a wonderful talk. It's great awareness. But as a therapist myself, or also a teacher myself, I do have one nagging question.
Yeah.
Is see people or individuals, whether it's teachers, parents who are watching this, so means they already in a way kind of have like the awareness or
Yes.
the
The
thing that
first
okay
step.
trigger me.
Yeah.
Correct.
Uh-huh.
So my
Uh-huh.
question is, there will be so, because these are actually the minorities, but how about the majorities of parents and teachers out there? So how do we then create this
The
spark?
spark.
Yeah,
Yes.
especially when
Uh-huh.
it comes to nutrition, because I think nutrition for a lot of Malaysians is not a topic, or it's not something that we actually
True.
would look into.
Yes, true.
I myself, I'm already in my 50s, and I only
Oh, you
start
don't look
looking into
50,
nutrition
definitely.
like, thank you, but I start looking into nutrition only like maybe 2-3 years ago. And before that, yeah, eat what I want, do
Yeah.
all that. Yeah. So that's really my, because right now that I'm also really looking into nutrition, I'm really very concerned with again the young generation. Like you said, I think for
Yeah.
kids to acquire the habit of nutritional things, it really all starts from the parents, from the adults. So
Yes.
then how then do we I know it's a very big, it's like changing
True.
the world thing, but
I know.
some tips, but some tips of maybe
Definitely.
what we can do even from
Mm-mm.
us as well
Mm-mm.
now that we are here. So from
Mm-mm.
us, what are the little things that we can do to start the ball rolling?
Okay. Thank you, Serene, for the question. Wonderful, wonderful question. It also the thing that I always um ask myself, if I do this, does this help other parents to have better understanding about the importance of food? Sorry, about healthy eating, right? When we talk about children, um, sometimes we need to understand how does a child work, something like that. They learn from doing. They
Yep.
learn from observing. So sometimes it's good to have activities relating to healthy eating with them.
Mm.
It goes not just when we talk about learning, we straight away think of schools, right? Not just the initiative shouldn't only come from school, but also at home, because we could do uh, by setting examples, having a meal time, bring them to the kitchen, get them to help at home, get them to help with the food preparation. Let them choose whatever food. Sometimes it goes beyond even to the shopping mall, even to the supermarket. Choose whatever vegetables that you want to eat. Then mama will cook. Choose whatever fruit that you think that you like to try. Then we'll eat them. We have that as the fruit of the week, for example, right? Okay, so that is something they can learn unconsciously, because it's a habit. It's something that is fun, being incorporated in at the house. For schools, yeah, we are very happy because for the schools to create activities involving when we apa ni, activities to encourage healthy eating. And my tips would be um make that as a gamification approach, meaning that to sometimes uh make it as a competition, because kids like to compete. They like to sometimes work in groups, and then they have when they have this kind of a competition thing that happens in the classroom. They will think more creatively, how to win, and then from there you can close it up with what are the points that we learned today. So why do you think it's healthy, something like that. And and always encourage that eating healthy is actually good and also delicious. All right. Eating healthy food is eating delicious food, actually. Yeah. So you can play around with whatever, because sometimes to a point where it's okay for those children who doesn't want to eat fruit. It's okay if you want to introduce strawberry dip with chocolate first. Okay. Right? As long as they are able to try strawberry first. I mean, try the fruit regardless having chocolates with it. So introduce the flavor, introduce the texture. Yeah. So those are the things that I could probably give you
Thank
some tips
you.
about.
Thank you so much.
You're
So
welcome.
I guess all of us continue to create all this awareness, and
Yep, yep.
hopefully, in the future we'll have a healthier nation.
Yes, inshallah. Yes, yes. I really
Yeah,
hope so. Because
right.
it's a bit worrying, actually, because with all the food that's coming out in the
Mm,
social media, especially in
mm.
Malaysia. I would
Yes,
say,
yes, and all those junk.
yeah.
Nowadays this generation has a lot of options. When it comes
Yes,
to
yes.
even junks have a lot of
Yes,
options.
yes. And they eat because they are following trend. That is what
Yep, yep,
worrying is. Yeah. It's
yep,
not
yep.
they eat because of the food, the quality of the food, but they are following trends. Yes.
True.
Yeah.
Now
And
that
it's
you
quite
mentioned this.
cheap. Yeah, and it's
Oh
quite cheap
yes,
compared
yeah,
sometimes,
yeah,
yeah,
definitely.
compared to
I
to
think
other
the
food.
unhealthier it is, the cheaper it is.
I know. That is
So
so
really,
true.
thank you. Actually,
Thank
all
you.
your sharing is actually giving me quite some a few ideas, but that
Oh,
would be
great.
for later. But for this session, thank you so much. It has been really, really enlightening, and I'm sure for the audience, they'll definitely get something. And for
Mhm.
myself as well, I actually got a lot.
Okay, good. Thank
Not just for my
you.
kids, but I think for myself. So thank you so much, and
Most welcome.
we really appreciate your giving your time to do this with us. So with that, and we hope there'll be future topics as well from you. Thank you so much. With that,
Okay, sure.
we will end this session.
Yep.
And for the participant, have a great weekend, and we hope to see you soon.
Thank
Thank
you,
you.
Serene. Thank you,
Bye.
everyone.